Hi, my name is Michael Harris, and I'm a child psychologist in Minneapolis, Minnesota, here in the United States. I'm also a foster parent and have worked with FASD and other childhood and adult conditions since the mid-1990s, including foster care and adoption, learning problems, behavior problems, depression, trauma, PTSD, and reactive attachment, many conditions of childhood. I often get asked, what is FASD? And this video is a quick one to explain what is FASD. FASD is the acronym for Fetal Alcohol Spectrum Disorder. And FASD isn't in and of itself a medical diagnosis. It's an umbrella term that describes a range of conditions that can occur in individuals whose mothers drank alcohol during pregnancy. The four types of FASD are Fetal Alcohol Syndrome, or FAS, Partial Fetal Alcohol Syndrome, or partial FAS, Alcohol-Related Neurodevelopmental Disorders, ARND, and Alcohol-Related Birth Defects, ARBD. Now, an individual's specific FASD type depends on four factors, and they are measurable, but it often manifests in complex and unpredictable behavior functioning. And that's one of the things that makes FASD so confusing for folks and hard to work with. Now, briefly, FASD type is determined by the severity level of these four criteria. The first one is confirmed prenatal alcohol exposure. So did the parent drink during pregnancy? The second condition is growth deficiencies in height or weight due to the prenatal alcohol exposure. And those are usually very significant growth deficiencies and kids in the less than 10th percentile at birth. The third factor are minor but specific FAS facial features that occasionally result from prenatal alcohol exposure. That would be the smaller eye socket size, flattened philtrum, which is the groove between the nose and the lip, and then a thin upper lip. And finally, the fourth condition is the severity of abnormalities in the central nervous system from the prenatal alcohol exposure, and that can fall into one of three categories. It can be structural, which is often measured by or assessed by measuring the head circumference, so very small head size. There could be neurological problems that are assessed by brain scans or doing exams for soft neurological signs like balance and things can often be a problem. And usually it's the third category here, the functional or behavioral problems that are assessed by psychological tests, and this could range from IQ to language processing, memory, gross motor play, fine motor skills, lots of areas that fall into that central nervous system, which can create so many different kinds of behaviors, which makes FASD a hard condition to figure out. So that is what FASD is, and I will be posting other videos describing the four different kinds of FASD. Thank you very much.